Sciatica isn't just back pain, it's nerve pain, and it can be brutal. Burning, electric shocks down your leg, numbness in your foot, and stiffness that can derail your life. But here's what many don't realize. When conventional medications fail, certain natural compounds, backed by science, can offer real, targeted relief. Sciatica happens when the sciatic nerve, the longest nerve in your body, gets compressed or irritated. Most commonly from a herniated disc, spinal stenosis, or muscle entrapment like piriformis syndrome. This triggers inflammation around the nerve root, leading to radiating pain, tingling, and motor dysfunction. Now here's where nature steps in. Turmeric, curcuma longa. The compound curcumin in turmeric is a potent anti-inflammatory. It inhibits NF-κB and COX-2, key players in nerve inflammation. Best used in liposomal or phytosome form, or as a tincture with black pepper extract, piperine, for absorption. Devil's claw, Harpagophytum procumbens, shown in studies to reduce lower back and nerve pain by modulating inflammatory cytokines. Best form, standardized tincture or capsule with 50-100 milligrams of harpagoside daily. St. John's wort, Hypericum perforatum, often known for mood, but it also supports nerve repair and pain modulation. Contains hyperforin, which affects sodium channels and reduces neurogenic pain. Use as an alcohol-based tincture for strongest effect on nerve tissue. Magnesium, especially glycinate or malate forms. Crucial for neuromuscular relaxation. Low magnesium can increase nerve excitability and worsen sciatica symptoms. Supplement or increase dietary intake. Topical capsaicin cream, from chili peppers. Capsaicin depletes substance P, a neurotransmitter involved in pain signaling. Applied locally, it desensitizes the nerve endings and decreases pain over time. Lifestyle counts too. Anti-inflammatory diets, myofascial release, nerve gliding exercises, and gentle yoga can reduce mechanical compression and systemic inflammation. Treating the cause, not just the symptoms. When painkillers don't work, nature still can, but not randomly. Choose evidence-based botanicals in the right form with the right delivery. Take back control of your sciatic pain, and bring this conversation to your healthcare provider. Relief may be rooted in more than just medicine. Subscribe and hit that bell button to stay informed.